Well, good evening, everyone. As you heard, my name is Russell Unrath, and I'm the CEO of MedCognition. And our mission is clear and simple. We want to revolutionize the way frontline responders train by providing realistic, ultra-portable, clinically intuitive simulations. We want to help others train to save more lives. According to the NIH, in the United States alone, it's estimated that 250,000 people die each year due to preventable medical errors. That means approximately 10% of all deaths nationwide are due to medical error. Other industries have high-quality simulators to help them train to reduce errors. Medical professionals, however, are left to play with heavy, unrealistic plastic dolls. MedCognition was founded in 2016 under the innovative eyes of these men. John Quarles, PhD, who is an internationally recognized expert in VR and AR technologies. Hector Caraballo, MD. Roland Paquette, physician's assistant and U.S. Army Afghanistan war veteran. Brian Dedman, and Kevin King, MD, educator, and U.S. Army Iraq veteran. These men came together to create a way to help others train to save more lives. I'd like to tell you just a little bit about our journey, and that starts with Dr. Kevin King. After leaving the Army, he joined faculty at the University of Texas Health San Antonio. He was a founding faculty member of the largest third-year emergency medicine residency program and a founding director of the emergency medical student rotation in the U.S. At this time, coupled with his experience in the Army, he continued to observe that current simulation technology was centered around, you guessed it, plastic mannequins that were simply unable to act or appear like actual patients. Kevin drew a line in the sand, and he began to collaborate with a series of colleagues, most notably John Quarles, as well as others from the University of Texas Health and the University of Texas at San Antonio, to conceptualize, design, and develop the first ever holographic reality medical patient simulator, which we call PerSim, and MedCognition was born. Now, you might be wondering, how did I get involved with this group? Just some guy from New Jersey who was fortunate enough to get connected with these wonderful people. I want to convey that passion with each of you that they shared with me that first time we spoke. You might be wondering, though, why a startup? Why this particular industry? Why medical simulation? All great questions. I'm so happy you asked me. My journey in corporate America started in 2002. I was a full-time student, and I joined the workforce full-time as well. I also held down several other part-time jobs determined to leave school debt-free. It was at this time I was told that I had a high tolerance for pain because I could have taken the easy way out and taken on student loans. But I continued to stay the course and keep juggling all those bouncing balls, which led me to a small and innovative company that was doing cutting-edge cancer research. Now, look, I was the lowest person there, packing boxes, ordering supplies, doing whatever I was told. Did I love it? Don't tell them, but not really. But I've always had an interest in the way medicine, research, and training can connect and relay and help someone's life that you may never meet. I shouldn't say always. That curiosity truly sparked at age 13 when the first major tragedy of my life occurred. In the span of a few short months, my mother became very ill, and she passed away January 6, 1997. Her cause of death was a series of complications that should have been prevented. Now, events such as this tend to have a serious impact on our outlook on life in general. And it was then I knew that somewhere down the line, I both wanted and needed to be a part of something somewhere that would shape the future of medicine. Fast forward over a career of ups and downs, and fate would have it that I connected with the MedCognition team in late October of 2020, and I officially joined as a stakeholder in December of that same year. I've always had an interest in training and connecting people. Now, my passion, my vision, our shared mission is remarkably clear to me. MedCognition exists to change the way we train. PerSim exists to change the way we train, to reduce errors so that all those on the front line can save more lives. Like I said, 250,000 preventable deaths each year. To put that into perspective, medical error tops the charts behind heart disease and cancer as a leading cause of death. If I asked you for a show of hands, I'm sure each of you knows someone who's been struggling with or lost battles to heart disease or cancer. But medical error? That's a whole different ballgame. The reason MedCognition exists is to drastically reduce that statistic by providing ultra-realistic, highly portable, clinically intuitive simulations. Now, over the last 6 years, our team has taken the idea of holographic patient simulation from concept to market, thanks in no small part to the dedicated network of amazing professionals at UT Health, Velocity, Capital Factory, NIH, AFWorks, and the dozens of other mentors and entrepreneurs in San Antonio who have so generously given us their time. We would not be where we are today without all of you. I am beyond excited because our team has created a simulation product where the sky is the limit. MedCognition has received $2.5 million in federal government development funds. Now, we've also achieved $2.3 million in commercial sales to date. And while PerSim is used by 72 organizations across the United States, I am thrilled to share that $1.3 million of that total was achieved in 2021 alone, more than doubling our customer base. We are for growth and success. I am confident that we will continue to thrive in the years ahead, and I look forward to our continued collaboration and involvement in the San Antonio business community. The sky is not the limit with PerSim. It's only the beginning. The applications are limitless. With your continued support, MedCognition's PerSim will be the front line in standard medical training. Thank you.